Hello and welcome to AI Studios. Today with us we have Javier Tordable. Hey Javier, welcome.
Hi, Natalia. Thank you for having me.
Javier is a technology executive. He is a technical director at the CTO office at Google Cloud, where he drives long-term strategy for Google Cloud. And he's been at Google for 15 years. He has a wealth of experience, a lot of it in AI, which I'm really excited to discuss and go deep into today. So, welcome. I'm really excited about this conversation, Javier.
Thank you.
I also have to say, I love your Instagram posts. Side note, you have the best taste in food. What's your favorite Seattle
Thank you so
restaurant?
much. Oh, actually, I used to have a whole bunch of favorites that closed during COVID, unfortunately.
Oh
So many
no.
of those are not really open anymore. But I like Japonesa, for example, in Union. Has really nice sushi with Spanish inspired rolls. That one was very nice. I like Lola. It's a little bit more of a Mediterranean, Middle Eastern kind of flavor. And yeah, I mean, I used to have a bunch more, but I haven't really gone out that much in Seattle lately. But thank you. I enjoy posting about food on Instagram instead of how my day is
Yeah.
going, right? Or like memes or like whatever
I'm
things
a
that
huge foodie as well. The only one I recognize is Lola. I haven't been to Seattle in a
Mhm.
while, but it was always one of my favorites. Um, yeah, so tell us a little bit about your journey through life. You've had an amazing career, 15 years at Google. We actually met at Microsoft when I
Yep.
think both of us were working on Bing at the time, like way back
Yes.
2010, maybe nine,
Oh,
something like that.
earlier. It must have been
Yeah,
2008 or 2009.
yeah,
Yeah.
yeah.
Yeah, so my background is actually in computer science and mathematics, which is what I studied back in Spain. Then came to Seattle to work for Microsoft. I was lucky to work in Bing, which was doing interesting stuff at the time. And back then is when I started to get very interested in AI. And this was mostly AI for ranking, for search. So traditional information retrieval and ranking. And I was there for a couple of years. I think it was a very nice experience. But at some point, I had the chance to switch, and I came over to Google, where
Were
I'm
you actually
currently
working
working.
on, I'm sorry to interrupt. Did you
Yeah.
actually work on rel or on ranking? That's
Yes.
what you
Yeah.
worked
So
on?
I was in Andy Lush's team back in the day, which was the core ranking team at
Got it.
Bing.
Okay. I was the
Yeah.
whole page relevance team. I don't know if you recall that used to be like um
I don't remember that. That
the
was the indexing. Yeah.
answers. No. This is like a lot more front end, like navigational query classifier, entity cards, more of like
Oh, yep.
taking the front end experience from 10 blue links to a rich media rich experience that integrated
Yeah.
images and videos and etc. and all
Yeah.
that
Yeah.
stuff. So you were like the
Um,
hardcore stuff.
Yeah, no, it was a little bit more kind of in between, right? But I would say, yeah, probably closer to that core information retrieval part of it. Yeah. But to be honest, right, like back in the day, I was very junior, right? So I didn't really have a good idea of the end to end of like how things are assembled into a final product. To me, it was later when I was at Google where I kind of started developing that ability to see things a little bit more broadly. Um, but when I switched, I started in search as well. Went over to what was called at the time Webmaster Tools. It was basically like Google Analytics, but for website owners. Did that for a few years. Then moved over to ads, which was a very interesting experience as well. Kind of seeing things from the other side of the search experience. Uh, and then I was lucky to move on to another team. It was called supply chain. So basically completely different, working on infrastructure for Google's own supply chain, like procurement of components for machines that we run in data centers. Very, very different from what I was doing before. And then finally, I joined Cloud about 6 years ago, where most of my work is actually client facing as opposed to building software. So mostly helping other companies leverage cloud, leverage AI for their own purposes. So, my experience, I think for the first, maybe like 10 years was more as a practitioner. And then the past, 5, 6 years has been mostly helping other people leverage technology for their own goals.
Yeah, so tell us, let's go deep into your role there because that is really interesting to me. Um, what is the life cycle of a project look like for you? Do you have projects or do you work on products? How does, and tell us whatever you can share. I'm just
Mm-hmm.
curious because, I come from like, it's always product. Although I
Yeah.
have worked at with enterprise as well, which I thought was amazing because I really enjoyed talking to customers. So how much do you define the product? It sounds like you do a lot of the strategy. How much do you do the customer engagement? What does your role look like? Give us a little bit more detail.
Yeah, so it's a little bit of a hybrid role, and not so much working on individual products, but part of my role consists in working with the engineering teams on the product offering for a set of customers. So, for example, I'm very closely involved with healthcare and life sciences. I work with a lot of customers within the healthcare vertical, so I have a little bit of an idea of what kinds of things are important for customers within that vertical. So I work with many of the product managers and the folks within engineering to make sure that our product offering for that specific industry is solid and competitive. But I would say
Yeah.
the majority
Mhm.
of my work, 2/3 or 3/4 of my job is customer facing. So working directly with customers on their own specific projects. And sometimes that translates into helping with projects that they have or helping with products that they're trying to get on the market. And sometimes it's a little bit broader and consists in helping them define their own strategy. So, for example, one of the customers that I work with before being in the healthcare vertical is Unity, the game tools and infrastructure company. So I worked with them for about 3 years, right? And that collaboration included a lot of different things, relating to how they could run some of the products on top of Google Cloud infrastructure, how we could partner in order to offer a joint product to another third-party customer within the gaming industry. We worked on helping leverage some of the AI infrastructure that we're building inside of Google Cloud as part of their product offering, and many other things, right? And now we have I would say Google Cloud and Unity have a very close partnership with Unity, for example, offers some of their SaaS products within the Google Cloud marketplace, right? So a lot of that stuff started around the time that I was working with them. And over the past few years, I've been focusing mostly on healthcare and life sciences. Some of those collaborations I can talk about. Some others can't say much yet because they're not public yet.
Yeah. I'm going to go back and ask you a more generic question, but I always love
Yeah.
to hear how people think about this. Just last night, I was listening to this talk on applying military tactics to tech strategy, like military strategy, taking all of those ideas and translating it into tech strategy. What are your tips for defining strategy when you work on defining one or, putting that together?
So I wouldn't necessarily think in terms of an overarching framework that can be used. I know there's a whole bunch of different frameworks that people have been using for for a long time. Strengths and opportunities and threats and so on and so forth, right? Or five forces, or there's a whole bunch of different frameworks. But I would say the way that I think about it is first trying to understand what the customer, what my customer, or what their customers want to do, right? Like, what are the problems that they're trying to solve? And then finding opportunities that there may be a good fit between what the technology or what the organization can help provide and what those customers are looking for. So For example, um, within within healthcare, right? Like this is something that comes up all the time. Uh, when you talk with different companies within the healthcare space, each company may have different incentives. So, for example, if you talk with an insurance company, one of the problems that they're trying to solve is how to process claims more effectively. Right now they may have large organizations of people that manually look at claims and try to review things and so on and so forth, and that carries a cost, of course, because there have to be a set of employees that look at all those things. Sometimes they make mistakes, they have to go back and forth. So you could go and say, well, they're, as an organization, one of the problems that they're dealing with is the cost of providing the services that they do. So, so then you can walk backwards and think, what kind of technology do we have right now that can help automate some of those processes or alleviate, some of the mistakes that humans may make and so on and so forth. And then we kind of, identify, what are the key opportunities for providing that technology to them so they can, use it and execute on those business goals. So, and, and that's, the same, across, the entire spectrum, right? I think the key in many cases is to develop that deep understanding of what the organization actually needs. And to give you an example, right? Very often, within healthcare, people talk about, using AI for diagnosis, right? Or using AI to, understand X-rays, right? And help doctors and so on and so forth. And we've been, as an industry, we've seen people trying to apply that technology for many years, and most of it hasn't really come to fruition and become available in the clinic. And I think the problem is that that's not necessarily an issue that provider organizations want to solve right away or that they feel as critical, right? Like, when you talk with a hospital chain, they don't come and say, well, the real problem that we're trying to solve right now is we want to improve the ability of our physicians to diagnose patients. That's just not something that necessarily come up, right? As organizations, they have other problems, right? They need to cut costs. They need to alleviate physician burnout. They need to be able to, ensure, a certain, level of quality, right? Like they need to be able to leverage the data that they have in EHRs effectively, right? They want to optimize processes and so on and so forth, right? They're not necessarily as concerned about, the quality of diagnosis, for example. So, without having the deep understanding of what a customer may want, it's very hard to drive technology projects.
Yeah, yeah, absolutely. That really resonates and matches so much of. What got you interested in healthcare, and how did you start working with healthcare customers specifically?
Yeah, so on the one hand, healthcare is especially interesting because the on one way or another we're all patients, right? Or we're all customers of healthcare, right? Maybe
Yeah.
not right now, but at some point in our lives. um on the other hand, I think like a lot of people that are attracted to healthcare, there was, a family member, and somebody in my family, got diagnosed with cancer, and that was a frustrating episode, just not being able to do anything, right? So I started to become interested in not just healthcare, but health in general, and longevity and drug discovery and the entire world of using technology to improve quality of life. So one way to try to contribute to the field or to try to continue learning was working with health customers. I'm lucky that in my role, I have a little bit of flexibility as to which customers or which specific industries I want to spend my time on. And I think healthcare was just more meaningful than what I was doing before. And to be clear, before healthcare, I was working with video game developers, which is great. I really enjoy the industry. I have, a lot of friends, who are or were video game developers, and it's fantastic. But I think it's not as meaningful as actually helping people, save lives.
Absolutely, absolutely. Um, what do you think is the current state of technology adoption in healthcare? What are you seeing? So I'll start with technology first because I think that even might be a challenge, and then the
Yeah.
second question is what does the adoption of AI look like in healthcare?
Yes. So healthcare is so full of contrasts, right? On the one hand, you know, there have been scientific discoveries that are absolutely mind-boggling, things that just a few years ago you would have thought they were science fiction. When I talk with somebody, I remember when I was learning myself about CAR T cell therapies, for example, right? Like these are chimeric antigen receptor T cell therapies. So they're basically immune cells that are taken out of a cancer patient. They are re-engineered genetically to add a specific protein that makes the cell more effective against a cancer, right? So we would sequence the genome of the cancer cells. We would come up with basically a toll-like receptor, which is a protein in the surface of the cell that would bind to that cancer cell, and then we engineer the immune cell to express that protein, and then we basically grow those cells, and then we inject them back into the person. And those genetically engineered immune cells, then they go and kill the cancer. And in many cases, we have cancers that were essentially death sentences. There was just nothing that could be done. And now with these therapies, we can go and cure those cancers completely. It's absolutely astonishing, the kinds of things that can be done. On the other hand, you have people faxing medical records, between one hospital and another, right? Or like you go to the hospital because you want to check your MRI and they give you a CD because there's no capability of, sending you a file, right? Or uploading it anyway. So there are a lot of contrasts like that. I would say in order to understand the state of technology within healthcare is important to understand what are the different incentives that organizations have and what really matters to them. So, for example, for a hospital, whether you can take the record, your medical record with you or not, is not an important technological question, right? The hospital, wants you to keep coming to it as an organization and as a business, right? So they're not necessarily interested in enabling easy data transfer between their systems and the hospital system and the EHR system of another hospital, right? So unfortunately, a lot of the economics of healthcare and life sciences kind of determines, how technology is leveraged. I think, one of the really interesting things, that is happening over the past few years, with the development of generative AI and large language models is that now we have tools that can help overcome some of the technology limitations in healthcare, right? So, for example, things that have not been developed over many years because there was no economic incentive, like developing APIs that enable data exchange between organizations, now can be solved by leveraging some of these AI systems that can understand unstructured data. For example, instead of forcing us to go through the traditional route of structuring the data, putting it in databases, putting APIs in front of them, and then connecting between different systems using APIs.
Into the adoption of AI for healthcare, you mentioned generative AI. Tell me a little bit more about what are those specific use cases that are really promising, and where is the industry in adopting them? I mean, it's probably new. All of this stuff is new for everyone, but what does it look like, and what are the opportunities? How do you think it's going to pan out over time?
So I would say things will probably move slower than we would hope, and they're going to take longer than we wish it would. I would say that's probably a safe bet, as with anything else in healthcare. So when you talk with people about the potential of technology within healthcare, I think one of the things that everybody is excited about is this idea of an AI doctor, right? Like you go and you chat with this with the system, like a ChatGPT or a Bard or whatever, and then you tell it your symptoms, and then it makes the diagnosis, and then it gets it right, and so on and so forth. I think that vision, as compelling as it is probably not going to happen anytime soon for a variety of different things, right? Including, for example, legal, issues, right? Like, what happens if an AI system makes a diagnosis and makes it wrong, right? Like, who's actually responsible for that? I think a lot of those questions have not been answered and will probably not be answered for many years. On the other hand, there are so many tasks in healthcare that are administrative or in a way do not require the qualifications that a doctor, that a physician requires. So I think we will probably start to see technology being used in those tasks much earlier than we will see it in tasks like diagnosis. And I think we will also see AI systems complementing physicians and complementing, other medical specialists without replacing them, much earlier than we'll see fully automated systems. So, for example, one thing that hospitals care about is whether a patient shows up for their appointment or not. Like hospitals actually lose, significant amounts of money when patients schedule appointments and then they don't show up. So we're probably going to see systems like, automatically making calls to people to confirm their appointments and talking with them and rescheduling appointments where they don't work and so on and so forth, right? Much more so than, like, I guess, dumb, text reminders or whatever, right? I think text reminders and emails and so on and so forth work well, but it's not the same thing as some system, calling, rescheduling if it has to, adjusting the schedule and so on and so forth. We're probably going to see extensive use of AI, including generative AI systems in processing medical data to make it easier to extract the relevant information so that a physician can look at it briefly instead of spending hours just going through it. We are going to see generative AI systems that create first drafts of medical information, say, processing results from a lab test, for example, and then writing a summary, which then a physician can go and review and confirm whether it's right or not. Because a lot of those tasks help optimize the time of the physicians, right? Which is, one of the main cost drivers for healthcare. I think a lot of those things are probably going to start becoming, more and more prevalent as soon as, the industry as a whole can overcome the constraints that limit, doing some of those things, regulation and availability of professionals that can implement, this type of technologies and so on and so forth. But I think this magical vision, right, of an AI system, taking care of somebody, that is not going to happen anytime soon.
One area that I'm really interested that's very relevant to healthcare, something I worked on at Meta AI, is privacy, right? Mm-hmm. So AI privacy, extremely relevant when you apply it to healthcare. So I'm wondering if you saw, and I think it's a challenge as well for building AI for healthcare. I'm wondering if there's some interesting things you saw there where you had to apply novel AI privacy techniques. Like, what are the kinds of things you might have run into?
Yeah. So I'm not a privacy expert, so take what I say with a grain of salt. In healthcare, privacy, of course, is top of mind, right? Because there are very strict regulations as to whether personal health information can be shared or not, and with whom it can be shared, and what happens if that information is somehow leaked, right? Which is, of course, HIPAA, right? And, we've all, at one point or another signed some HIPAA form when we go to, some hospital or doctor's office or whatnot. So this is something that is, on the one hand, a positive because everybody is aware of the constraints. On the other hand, it slows down progress in some way because
Yeah.
everything just takes forever, right, to get approval and to make sure that things are done properly. And sometimes things take longer than they should.
Are there
Um,
any AI privacy technologies that like you're kind of your favorites or that you saw were really
yeah,
necessary? I have a couple
I
on the
would
back of my
say,
mind. I want
yeah, yeah.
to shout
Uh,
out.
so the one thing that I've seen being very useful is synthetic data, right? So
Uh-huh.
basically trying to sidestep the privacy issues of PHI completely and generate data that looks like it's almost real, even if not quite. So being able to generate synthetic data, I think, is very, very useful for a lot of different things. And sometimes it works, sometimes it doesn't. So in the case of EHR records, I think synthetic data is very, very useful because you can get data that essentially looks like real and only an expert, somebody that has seen, thousands of EHR charts would be able to say, well, yeah, this is off, right? Or this was actually, made up. Um, in other cases, it's really hard to do. So, for example, in the life sciences side of the world, synthetic data just, it's just not as useful, depending on the specific problem that one wants to solve. So I think that is a very interesting aspect, and our ability to generate better synthetic data is getting better. I would say federated learning is also super interesting, and I've seen people do really interesting things in a federated way, but like say different hospitals or different organizations will share part of the data, and we train machine learning models that learn from the overall data set, but without necessarily having to share their own data. But I'm also not an expert on federated learning, so I see it, I appreciate it, I think it's interesting, right? But
Yeah.
yeah.
That was federated learning was one of the big bets for the AI privacy team that I led at Meta. Um, the other thing we worked on was I was hoping I'd hear you say differential privacy because like there's one thing which of course differential privacy is used with federated learning, and there's like some really interesting things that happen there where you have to like you might take a cost of accuracy. You might have to do like a trade-off of accuracy
Yeah.
with privacy and so on. But anyway, the one thing I learned that was really interesting from, it is actually that anonymized data is not really
Mhm.
anonymized and how
Mhm.
easy it is to
Yeah.
de-anonymize it. But yeah, healthcare was always sort of like the first thing that pops up when you go and you do a deep dive into AI privacy. It's like the one specific vertical where it's super applicable. So yeah, I'm sure we'll see more there.
Yeah. I mean, I think it's, of course, like everybody can imagine the risks, right? A lot of healthcare information is as private as it possibly get, right? And it would have significant repercussions, right, in people's, lives and families and jobs and so on and so forth. Um, yeah, in my mind, that is, I think, a good rationale for trying to use synthetic data as much as possible, right? Where we're basically sidestepping, all the potential problems.
Yeah, so this brings me to an interesting point that you wrote about and you wrote an article on AlphaFold. And for anyone that doesn't know, AlphaFold is a deep learning system which approximates protein shapes. It was a
Hmm.
big, big breakthrough, and I think Google has like a lot of work in this area as well. But I think that the thing that struck me was, and maybe this is your hot take. I'll be looking for hot takes. I want to hear your
Sure.
healthcare hot takes. But one of the things you mentioned is we will not see significant development in personalized drug development because there's not enough
Yes.
data.
So yes, so I think that is a very interesting and very interesting point, and you touch on a lot of things, right? So AlphaFold, in my mind, is one of the um, one of the most significant achievements of artificial intelligence in healthcare and life sciences as a whole, right? I think it was truly groundbreaking, and it
Explain
was a
why,
system.
and can you break
Yes.
it down for like why that is? Why?
Yes. So for many decades, right? This is something that goes back 50, 60 years. We've the scientific community understood that there is a relationship between the shape of a protein and the function that that protein has. So, an enzyme, for example, enzymes are proteins that kind of help assemble or disassemble other components. So in an enzyme, you would have a pocket, right, or an area of that protein where different components would join in, and then that enzyme maybe gets energy from ATP, and then joins those two components together, and that's what assembles another macroprotein, right, another macromolecule. So the function of that protein is what determines the shape of that protein is what determines its function. Now, for many years, there were a lot of different experimental techniques that were used to discover those shapes. Things like X-ray crystallography and nuclear magnetic resonance and a lot of other experimental methods. But those experimental methods have limitations, right? And in some cases, it's very hard to use an experimental method. For example, in proteins that are intrinsically disordered, like many proteins that happen to be in the surface of different cells, right? Like surface of neurons, for example. So what AlphaFold does is it takes a lot of data that had already been assembled over many decades, stored in a database of proteins. It's called PDB, and the Google DeepMind team built a machine learning model that takes a sequence of a protein and predicts the shape. And the quality of that prediction is really, really good. So we had models before that attempted to do the same thing, but they were not really great. Sometimes they would work, sometimes they wouldn't, and we wouldn't really know very well, when they wouldn't work. AlphaFold is much, much better, like significantly better, to a point where it can be used for real-world problems when we don't have an experimental structure. So in that sense, it's in a way solving a problem that had been open for many decades, right? So just as a scientific achievement, I think it was very significant. Now, of course, there are other ways where you could start applying this same principle. Like, for example, when somebody has a genetic mutation. When you're getting experimentally a structure for a protein, that is a process that costs a lot of money and takes a lot of time. So, for example, if somebody has a disease that has genetic origin that is caused by a mutation, I don't think anybody would go on and think, well, let's try to isolate this specific protein and somehow get the structure and try to understand, what kind of, drug we would be able to develop for it. Like, that process would take years and it would be very complicated to do, and it wouldn't be economically feasible in the context of healthcare. But now, if you have some kind of synthetic model or a synthetic process or a process that you can run entirely within a computer, where you can get somebody's DNA and understand the effect of those mutations in the shape of the proteins for that specific individual, that kind of opens up the door for a more personalized way of doing treatments for that person. And that may not be developing new drugs, which I think is where you were going with the second part of the question. I think that is probably still going very hard, but it could be trying to predict whether the existing drugs would work for that person or not. So, for example, in the case of cancer, I think this is something that many people have started to explore already. If we know what specific mutations happen in cancer cells for one person, and we know how the structure changes, we can see if, let's imagine that we have, several hundred chemotherapy drugs approved. We could, in the computer, try to predict which specific chemotherapy drugs would bind better to this mutated protein that this person have. And then instead of, giving, 100 different drugs or trying one after another, we could use that specific chemotherapy drug for that specific cancer for that specific person, right? Which would obviously be much more effective than the, shotgun approach, right, that we've been using so far. So I think just from that perspective, I think it's incredibly interesting. Now, what I think is going to be a little bit harder is to go from this ability to sequence a genome of a person and to sequence, cancer cells and so on and so forth, and to come up with the structure of those proteins and how they interact and so on and so forth. I don't think we will get to a point where we will develop entire new drugs just for that person. And the problem for that is the regulatory and the approval processes don't really enable that, right? It's really, really hard to go through, clinical trials and so on and so forth, and to convince the regulatory authorities that a specific process, works for that problem. So I think that that aspect of personalized medicine is probably not going to happen for many years, but there are a lot of other things that we can do even without going to that level.
Got it. So let me make sure I understand this. It sounds like then what we can do is better target the current therapies for specific people versus developing specific drugs for specific people. So that level of personalization is not, we're not near that sort of sophistication. Yeah, I think that's huge. That would be amazing.
Yeah, and to add some context, right? Like we know now that there are many drugs that just don't work for a lot of people, right? Like I think there was some statistics that folks have computed over the past few years where your average FDA approved drug works for I think 30% of the patients that it's applied to, right? Something very, very low. Like you normally think, well, if I have a drug that is already approved, it should work for like, 95% of the people, right? It's actually, very, very far from that, right? Like your average, approved drug actually doesn't work for most of the people that we give it to. Which is why, of course, we have to try many different things, and we have a lot of different drugs for different people, right?
Another area you're really passionate about is longevity. I think there's a couple of things I'd love to learn about. What are some breakthroughs, that you're excited about for longevity?
So longevity is an incredibly interesting field, right? Also for, similar to what we talked about before, I think, everybody is interested in living a long and healthy life, right, as much as possible, right? So I think, one way or another, all of us should be interested in how we can maximize our own longevity. And up until a couple of decades ago, it was very hard to do something about it. Like our understanding of the drivers of aging was very incomplete. Now, there have been several discoveries over the past, 10, 15 years that are really exciting because they kind of show us how we can actually start tweaking things to live longer. So, for example, one of the things that we have known for a while, and this is something that, Peter Attia, for example, was talking about in his book, and many other people, have been talking about for a while, is rapamycin. Rapamycin is a drug that was discovered several decades ago. It was an immunosuppressor, an antifungal. It was used in organ transplants, and my understanding, it was not especially good immunosuppressant, but it turns out that when we started giving rapamycin to a variety of different species, those species live longer, and that effect is most pronounced in shorter-lived species than it is in longer-lived species. So you could give rapamycin to a worm, for example, and it would live twice as long. And you would give it to flies, and they may live, 50% longer. Then you give it to mice, and then the mice lives 15% longer. All other things being equal, right? So no change in the diet, no change anywhere else in the conditions of that animal, except that it's just taking this drug at regular intervals throughout their life. Even, I think, in non-human primates, people have been, effectively using rapamycin to extend lifespan. So because the effect of rapamycin seems to be conserved across all these different species, I think there's a very strong suspicion that it would help to extend lifespan in humans as well. Even though nobody has done a clinical trial for it yet, but I think there's very substantial evidence. Another thing that we discovered recently was senolytics, right? So one thing that happens in human cells is that in order to prevent cancer from developing, when cells detect that there may have been dangerous mutations, they enter a state in which they stop reproducing, which is the state of senescence. And then, this is good, right? Because that cell that becomes senescent does not become cancerous, but it's also not good in the sense that the cell is a little bit in a zombie state. So it secretes, substances that are not good. It kind of creates inflammation and so on and so forth. So about 15 years ago, there was a team actually at the Mayo Clinic that discovered substances that selectively kill senescent cells. So they eliminate the noxious effect of those senescent cells. Those substances are senolytics. So they gave a combination of them, they were dasatinib and quercetin, and that combination would remove those senescent cells. So again, like you would take these mice and you compare them with a control group, and then you give a group of mice a senolytic. I think it was, once a month, right? Which would be the equivalent of like, once every, 6 months or a year for humans. And then those mice would live 10 to 15% longer. Everything else was exactly the same, but now because you're removing those senescent cells regularly, the mice lives longer. So I think that is also very, very exciting, right? And people have been using senolytics in other species as well. The last thing that happened over the past decades, I mean, there were many other things, but the last thing that I would say is interesting, I think, broadly, is the ability to partially reprogram cells. So, cell reprogramming in a way is something that occurs naturally, right? So when somebody, gets pregnant, right? When a female human, gets pregnant, the egg, right, is a cell that has a certain age, right? That cell, was formed, many years ago, right? So it has a certain age, and then when that cell starts to become an embryo, right, there is a process that happens in which that cell, which was older, it may have had, many years, suddenly becomes younger, right? The age goes down, and then, the embryo grows, and then, a baby, forms, and so on and so forth, right? So that is a process of rejuvenation, but that is a process of totipotent or full rejuvenation in the sense that the cell stops being an egg and it becomes an embryo. Now, what we found out many years ago is that you could, this was done by a team in Japan. They discovered that you could. So the rejuvenation process, was done by a team in Japan, and there were, other teams, Alejandro Campo and others that discovered that this process could be done on a partial level. So you could take a cell and add some chemicals to it that would, in a way, remove some of the changes that happen on that cell over time as it ages, but without necessarily changing the identity of the cell. Right. Mm. So in humans, you could inject, have the human take these chemicals and then have the cells rejuvenate, but then that wouldn't be good, right? Like you want your skin cell to continue being skin, you want your bone cell to continue being bone, right? So you can't just do total rejuvenation in human cells. But if you could partially rejuvenate those cells so that they somehow become younger, but while keeping the identity, that would, in theory, eliminate a lot of the problems that happens as we age, right? Eliminate some of the damage that accumulates, eliminate some of the, methylation or other, transcription modifications that happen in the genome, as the cell, ages and so on and so forth. So now there is very substantial funding that is going basically into discovering how these partial reprogramming mechanisms can be used in order to rejuvenate cells of people that are, already alive, right? So Altos Labs, for example, was a company that was formed a couple of years ago, right? They had several $1 billion of funding. They are doing research in this space. Retrobio and many others, right, have been looking at, can these methods of partial rejuvenation be actually used to get our cells become younger again?
That is fascinating. I'm going to go read up on it. Now, the question that everybody wants to know, what are your personal longevity hacks? Like, are there any things that you do on a regular basis?
Yes. So I actually, so it's funny that you mentioned, I actually wrote a little article not long ago with my own longevity protocol, which is not super sophisticated, right? Like there's people out there who are spending, lots and lots of money doing this. I think Brian Johnson, right? Is the name of this, tech entrepreneur, right? That
Yeah. Oh,
supposedly is
yeah.
spending a couple million a year, trying to do, trying to
Notorious.
get
Yeah,
himself to be
yeah.
younger. I think it's possible to get like 80-90% of the benefit for much lower cost. So, um, in my mind, the fundamentals of longevity are, the same fundamentals of health, right? So, good diet, good nutrition, proper sleep, and so on and so forth. Avoiding all sorts of, cancerogenous, foods and habits, and so on and so forth, right? So a lot of that is the same, basic stuff that we've many of us, have heard about for many years, right? I would say beyond that, there are there are a lot of things that we can start doing to optimize our own biochemistry, right? So I think intermittent fasting, for example, is very useful. I think there is maybe a little bit of evidence to start, taking some of those substances that could be senolytics, right? Not as powerful as the dasatinib and quercetinib combination, but curcumin, for example, visitin, right? Like, there's a little bit of evidence that this senolytics actually, do something useful in other species, even though, again, nobody has done clinical trials in humans. And for folks that want to go a little bit beyond that, I think there's already quite a bit of a community of people that are taking rapamycin, right? So I think that is interesting to consider as well, right? But of course, it's a prescription medicine, right? So,
Right.
folks need to, coordinate with their physician and all that.
We will find and link to your article. On my end, I keep it very simple. I try to eat good food. I try to cook my own food as much as possible.
Yeah,
Sleep and get at least 3 hours of exercise per week. Like that's it.
that's
Uh,
great. Yeah.
but yeah, no, I always want to learn more. Let's take it in a totally different direction. There are a lot of people who work either in tech or in healthcare, and are
Mhm.
interested in crossing over and combining their expertise in one area with another. So, for example, I just had a doctor friend who really wants to learn more
Mhm.
about AI.
Yep.
How does he combine his medical experience with technology, which is not his area of
Yeah.
expertise, but there's so much opportunity there? Or the other way around. What if you're a tech person and you want to learn more about how you can apply your skills to healthcare? What would you suggest to those types of professionals? Like how do we cross boundaries? Because there's even within technology, people speak different languages depending on what they work on or whether or not they work on research versus product. Like research famously has its own language. And sometimes they don't talk to anyone else, which is my complaint. But yeah, like what would you suggest to those professionals who want to combine these two fields?
Well, I think it depends on the specific skills, right? But thankfully now we live in a world where it's a lot easier to find other people that are working on the same, problems that we're interested in, right? So I would
Mhm.
say a physician, for example, you could go and find, technology companies that may be working on some of these problems and think if it's possible to set up a collaboration or whatnot. Another thing that is very interesting is that much of the technology that we have today is becoming easier to use, right? So like large language models, for example, are arguably much easier to use than traditional AI models, right? So anybody can go and, Bard or ChatGPT or whatever and start playing with it, right? Or write a few, maybe, use the model to write a script that, leverages, some API that, kind of, tries to, understand medical information or whatever, right? So I think a lot of those things are becoming easier today than they were, just 4 or 5 years ago. And then apart from that, I think it's always useful to keep an eye on where technology is going, right? Because we don't know what kind of new products would be available, right, in the future that may actually change the way that people go about their day to day, right, in that profession. But I mean, all in all, I think AI has advanced so much, right, and has become so much easier to use, right, that I think, pretty much everybody should have a little, at least a basic understanding of what kinds of things are possible right
Awesome. I have another personal question for you. What advice would you give yourself, like a younger version of yourself from 20 years ago?
now. Yeah, that one's hard. I don't know if there's something that would come top of mind. I mean, if I could go back in time, I would say, just buy stocks and companies, A
Yeah.
or B or whatever, right? And then, I would be retired by now, or doing something else. I wouldn't be working. Um, uh, I think I was very fortunate that I chose um, to work in the technology field. I think this past couple of decades have been definitely the time of technology, right? Technology companies have done really well. I've been very lucky to work on really interesting things. Of course, nothing is perfect, right? But I would say I've been very, very fortunate to be able to do that. But if I would say, I'll answer a different question, right? So if I was talking with somebody that was 17 or 18 years old, I would say I would think very carefully about um, joining the technology field as opposed to doing something else, right? I think, for a lot of people that may be, thinking about, studying, law, right? You know, we don't know how much of law is going to be automated in years to come, right? Somebody that may be studying marketing, right? And maybe we reach a point where, most of marketing is just, done by machines, right? So I would be very careful about what kind of disruptions may happen in specific industries over the next few years, right? So I think, you know, if I could, give advice to somebody that is now, 16 or 17 years old, or, maybe thinking about going to college, I would, strongly encourage to look at technology and think about whether or not it'd be a good career.
Well, as somebody who also majored in math, of course I don't have a doctorate, I'd say study math. If nothing else, it trains the mind, which is always useful, critical thinking skills. So what are some things you're excited about, whether they are, business opportunities, product opportunities? What's next for you? What are you excited about and what's next?
Definitely. So, lots of things. I mean, there's so much, there are so many exciting things happening, even just within healthcare and life sciences. So, I am personally very, very excited about the potential of AI and large language models to help us find new drugs. I think that is an amazing opportunity. Being able to use some of these methods that have been coming up in the past few years, plus whole genome sequencing, plus the ability to understand medical literature, by large language models and so on and so forth, to automate or to make maybe not even fully automate, but to make the process of drug discovery easier or more powerful. I think that is incredibly exciting. Um, it's incredibly exciting because there are so many diseases for which we don't have any drugs, right? And in particular for longevity, there's an enormous amount of opportunity to tackle different aspects of it, and the limiting factor in how much we can do is going to be how many new molecules we can come up with, to do the kinds of things that we want to do, the kinds of manipulations that we want to do. Um, so, so to me, that's probably the most interesting right now. But there's a whole host of other things that are happening, right? From being able to process information automatically, right? Which makes for example, makes healthcare more affordable, or more accessible to a lot of people who traditionally haven't had that opportunity, to reducing waste, right, lowering costs, right, and so on and so forth. I think we're kind of still at the beginning of this generative AI world, and it's hard to say, what is going to be, more exciting or less exciting, right? I think at some point, we will be able to figure out how to go from really good, interesting technology to actual products that save time and help people in their day to day. So I think that's going to be, an enormous amount of opportunities there as well, right? So personally, I'm interested in longevity. I'm interested in what kinds of things can be done from the perspective of technology and AI to help find new drugs and help drive further work on longevity. But it's we live in really, really interesting times, right? So there's definitely a lot of exciting stuff happening out there.
Yeah, indeed. No, I think it's incredible the pace of innovation that we are seeing now, and it doesn't stop. It's just going
Of course, yeah.
faster, and it's just so difficult to keep up with it. But yeah, I think it's an amazing time. Thank you so much, Javier. This has been an amazing conversation. I learned a lot, and I can't
Thank
wait
you.
to see what you do next. Thank you.
Thank you so much, Natalia. It was my pleasure. Thank you for all these interesting questions and interesting and exciting conversations. So I enjoyed it very much.
All right, take care, Javier.
You too.